Kia ora tātou, and a warm welcome to Wellington, to the Rural Health Network. Can I acknowledge Linda? She joined in with the talk of body parts this morning and talked how lawyers go for the pocket, but of course she was a gallery journalist, and of course they go really for the throat. So it's nice to see you here, Linda. Can I acknowledge the leaders within the network? And a particular acknowledgement of Norman Sharp. I've been a big fan of Norman's for many years, and I can tell you, Norman, I have been listening when it comes to your plea around the priority for NCDs, which I'll talk about in a moment. Tim Malloy, Tim and I have sparred for many years in the past, and I acknowledge your commitment to rural general practice. And Sharon, a nurse practitioner. Sharon, I totally support nurse practitioners. As you probably know, they started under my watch, and I am surprised at the lack of progress when we have over 1,000 nurses with masterate and higher degrees wanting to be part of the nurse practitioner model in New Zealand. Let me start by saying I think it helps to understand rural health if you actually come from a rural health background. The evidence tells us that. I come from Murchison. 600 people, a small cottage hospital. Norman mentioned in his own background. We had a GP, we had some nurses, we had a visiting dentist and a pharmacist. I now represent one of the most rural electorates in New Zealand. You wouldn't think that of Wellington, but I represent the Chatham Islands as well. And of course it has 600 people, a small hospital and nurses, a GP and pharmaceutical sent from Wellington, visiting dentist. And so living and providing health in rural New Zealand is often really scary for those who have never experienced it. So recruitment and retention of a rural health workforce has been and is an ongoing challenge in New Zealand, but not just in New Zealand, it is in many parts of the world. And in fact, based on the evidence that was provided to me as Minister, is why we went down the path of recruiting for medical students out of rural New Zealand and making places for them, because the evidence tells us if they experience it, they're more likely to go back. But health workforce planning has been fraught with difficulty, and as you know, it is a political football at times. As Minister, I set up the Health Workforce Advisory Committee to look at what our future needs might be, but it was criticised for being too slow, too many reports and not enough action. And then, of course, we now have Health Workforce New Zealand, and we're 5 years on and we have more reports, and we still have problems in our health workforce. And now we have different problems to what we've had in the past, one of a growing shortage of nurses. And this is a real problem, and Health Workforce New Zealand believe by next year we will start a big problem in nursing shortage in New Zealand. But we also have a shortage of GPs, and 40% GPs in New Zealand, and I was talking to Helen from the College of GPs last night, and she was saying that those new grads, only 18% are going into general practice. So we have got a problem in terms of encouragement into general practice. So health workforce, particularly in rural New Zealand, but also in low-income parts of New Zealand, must feature in all political parties' policies at this election. And I'm going to give you our 8 priorities for this election, and I can tell you it is one of them. We do have a vision of a society where health outcomes are not predetermined by location, ethnicity, or your ability to pay. And we believe that it is time to rebalance the allocation of health resources, prioritising for long-term health outcomes and to address the health inequalities that actually lead to the causes of poor health. We base our policy on 6 main principles on prevention and early intervention, health going across all portfolios. You can hardly find a portfolio where health does not have an interaction with it, with collaboration, with evidence-based and universal access, and a long-term approach to your priorities. Our first priority, and it wouldn't be a surprise to many, is we believe you have to reduce the health inequalities in New Zealand. And when Norman was talking about rheumatic fever, then you go immediately to some of those causes of overcrowded housing, cold, damp housing in New Zealand. We have to eliminate child poverty, income adequacy, employment, access to affordable health care. So reducing those health inequalities go not just to health, but across a wide range of portfolios, and have become a major priority for our health portfolio. The second one is reducing NCDs, and these aren't in any particular priority order, they are the 8 priorities. But reducing and preventing NCDs is going to be so important to us in the future, and the management of chronic disease. And the big 4, the cancer, diabetes, cardiovascular and respiratory illness. I think the big tsunami hitting us are those 4 big problems. And we do not have long-term strategies for them. We have bits of policies around them, and unless we take a coherent approach in terms of addressing things like obesity and smoking and alcohol and housing and the things that lead to NCDs, then we will not have a budget that is big enough to deal with them, and we need to start now. The third one is primary health care, and I start from the position that we ought to reinvigorate the primary health care strategy I released in around 2000. It is the keystone to the backbone, in my view. It is a very good guiding document because in that it recognises not only affordability but the involvement of our communities within primary health care and the importance of having community involvement in decision making in their communities, something that you do every day in rural practice, because it's the only way you can work is working with your communities and collaborating. The fourth one is mental health, and I was sad when mental health no longer became one of the government's priorities. It is the easiest place to raid money from, and we saw it for years. And that is why I'm so committed to us ensuring we keep mental health at the forefront, particularly going for the recovery model within the community. The fifth one is oral health. It reflects my old background, of course, as a school dental nurse, but it is often a forgotten and important part of health. And if you want to see where poverty is, have a look in the mouths of those who walk up the street with very little income, who are on benefits, who come from hard circumstances. We have a big problem. We are going to retire with our teeth, and that's going to be a much bigger health problem for this country than when they go into rest homes and we can take their teeth out and clean them. So oral health for pregnant women, for older people and low-income people is a priority. And I've got details on all these, which I'm happy to share during the election campaign. Of course, aged care is a big issue. We are looking here for quality, for standards, for staffing and for training. And there is a big opportunity for us in this area. We have over 100,000 people working now in the unregulated health workforce. And this is an area where we're going to need to plan to ensure that they have training, that there are standards, and that we're able to provide much of our health care, a self-health care, back into the community in the future. And the seventh one is children's health. I want to acknowledge the work and the chairing of our Health Select Committee by Dr. Paul Hutchison. The 4 of us were on that committee, and we produced a magnificent report. It's preconception through to 3, but looking at those early years based on evidence and what works. And the last one, of course, is the health workforce. And that health workforce is one where I think we're going to have some real challenges. But I think there's some opportunities. Tim, with the oversupply of doctors, there is an opportunity to convince those doctors there are work opportunities and they exist in general practice and in rural New Zealand. I'm not so worried about a little bit of stick to go along with the carrot pool. I think we've tried voluntary bonding. Perhaps it's time we tried some more of the stick in terms of the investment that goes into training our health professionals and where we need them in New Zealand. Leaving it to choice has meant that we have big mismatches between provision. In Auckland, it's so obvious. South Auckland, very few in general practice. In your area, Paul, I think, no, perhaps in your rural. In central Auckland, you will find many practitioners. And so I'm prepared to look at different ways of doing things. I also think that we have to look at the new graduate to practice program. We had 600 nurses graduate who got jobs out of the 1,328 in December, January this year. And they are not guaranteed opportunities to go into practice. So it's the old vicious circle. No experience, not wanted. Not wanted because they haven't got any experience. So I think in rural practice, there's huge opportunity to actually change the funding for the nurse graduate to practice in the way that we do with new graduate doctors, and help to place them into our rural communities as we place young doctors around our DHBs. With it goes a funding program. That's often been the bear bug. Why would you take on someone when they're a cost? They don't know much, they need to have additional training. So I think that there are huge opportunities in the utilisation of our nursing workforce and our allied health workforce, our unregulated workforce, alongside our vital general practice. Perhaps I will just conclude by saying that you work in a cooperative way, and when we look at what we're being told about the future by Treasury in particular, they're saying that our funding, our public funding, will go from 6.9% of GDP to 11.1% in 2060. And that's based on the fact that we're going to age healthily, that we're going to see productivity grow, and we're going to have technological improvement. So it's quite heroic assumptions they're making. The only way we're going to be able to deal with the challenges within the existing tax-funded provision, which I support, and actually Treasury supports, which was wonderful to hear. They said they couldn't find a better system, but we're going to have to look at providing our health care differently. And the leaders in that, I believe, comes out of rural health, because you now have to work together. You've got to cooperate with the pharmacists, the dentists, the nurses, the doctors, the community, the local government, and so on. And so that cooperation and providing within the community, what they're now calling the whole person care, is going to have to be the way of the future, combined with that prevention and early intervention. So they are a few thoughts on our policy, and you will hear more in the next 191 days. Kia ora tātou.